Hi, my name is Dr. Ganeshwara. I'm a radiologist and a consultant intervention radiologist, currently practicing in Damansara Specialist Hospital 2. So, radiology plays an integral part in the management and treatment of stroke. From the time the patient presents to A&E, the patient is promptly moved to radiology department for the purpose of imaging. Either a CT scan or an MRI is very important in the diagnosis of stroke, either to rule in or to rule out a stroke. It's also important to see strokes, the area of strokes, how large it is, and also to rule out other stroke mimics, meaning patients may present with symptoms of stroke, but it's not actually a stroke. For example, a tumor, a mass, infection, or other degenerative disease that may have symptoms that mimic a stroke. Now, moving on from diagnostics, there's also intervention. So intervention radiology is also a growing field. If the patient has been confirmed to have a stroke due to blood clots, for example, patient is then managed and assessed to see his feasibility for thrombectomy, which is the procedure where we pass a catheter through the vessels into the brain, and the clot is then removed to restore flow back to the area that has been affected by the clot within the vessel. As I mentioned earlier, CT scans, MRIs, and angiography are all part of stroke management. With the more latest MRI machines and CT scan machines, strokes are then picked up faster, more accurately, and therefore that leads to a better planned management for a particular patient. For example, the MRI at DSH2 is a 3T machine, which then can therefore do more complex sequences that can demarcate the areas of stroke and the vessels involved in the area of stroke. Our CT scans are also dual source CT scans, where scans are therefore done much faster, and therefore if a patient, for example, is restless, scans can still be done and good quality images can be acquired even in patients who may be restless. Moving on, angio machines. We also have a dual head angio machine, which that means we don't have to do multiple sequences. One sequence will be able to pick up the areas of stroke and be treated accordingly. So intervention radiology is a new but a rapidly growing field. It encompasses all disciplines. It can be involved in the simple thing as putting in a granula for a patient with a difficult IV access. It can then range from other venous accesses, drainages, biopsies to clinch a diagnosis, or to drain out abscesses, for example, that may avoid a patient from going for surgeries. More complex procedures such as embolization for patients with active bleeds from either the abdomen or solid organs or even the brain can be achieved with intervention radiology, and therefore doing away with the need for surgery or more invasive procedures. Intervention radiology is used in the treatment of malignancies, where aside from surgery, the tumors can be ablated, meaning it's burnt or frozen, or it can be embolized with chemo drugs together with embolic material to kill off a tumor.